Now, here's where it's time to start getting angry about what happened in New South Wales. Because while the Chief Medical Officer in New South Wales was trying to ramp up the fear because a kid ended up testing positive while he is on holidays from Victoria in regional New South Wales, something very bad was happening. First, the scaremongering from the officials who were talking about the border, within the border, next to the border, on top of the other border.
We need to just be vigilant because the disease has been grumbling along. It clearly is appropriate that we take that next level of buffer.
Now, that lady's the Chief Health Officer. She is part of the health operation in New South Wales, an operation that, let's be honest, has done a relatively good job, asterisk Ruby Princess, but has generally speaking done a good job. Until, what about this? People were able to get off a plane from Victoria and there were no health checks when the people got off the flight from Melbourne. Now, without giving terrorists a handbook about how Sydney Airport works, anyone who's flown domestically knows there is one exit. Once you get off the plane, go up the gate, go past the shops, there is one exit that you need to go through before you either collect your bags or go out and get a cab, go to the park, or somebody will pick you up. One exit. Yet apparently, people were too busy scanning other flights and let an entire flight of people from Melbourne, where we have no idea, and apparently 40 of the people on the plane might be from suspect areas, these people were not checked. An email that was leaked today to a Union News website from Sydney Airport claimed that Jetstar had breached the New South Wales health orders by allowing travellers on flight JQ 520 to land at 6:53 p.m. and they got off without being checked. The final JQ flight arrived and staff were able to disembark without New South Wales Health or police in attendance. There is one exit at Sydney Airport. When asked about it today, the very same health official that is trying to scare the shit out of people who live in regional New South Wales said this about the failure of her own system to cope with it.
There was an issue at the airport where passengers were disembarked when the health screening team were screening another airline. The airport have now put in protocols to ensure that the health teams are there and are able to do the screening, and no one's allowed to disembark before that happens.
Here we go again, just an issue. Like the Ruby Princess was an oversight. That went on to kill more people than anything that's happening in Victoria right now. And I get it, it's tough. But you're not wrestling smoke like you were months ago, and we're at a location where there's one freaking exit. And again, the headlines make it very clear. They were going from gate to gate to gate. And put simply, people were allowed to leave because the health teams were busy. Rather than just the trickle of domestic flights being policed at the one place where everyone gathers, where everyone's temperature could be checked, none of that happened. Now, I'm just a moron on television and I understand that this is what should be happening. How do you, the professionals, not understand what's happening? You can come up with these mallet-like approaches to treat people in areas that have never had the virus as if they are the poison that is going to kill the rest of the country. But you can't work out that there's one freaking door that everyone's going to be going through. This is your job. When you don't do it, people suffer. Like the people in Victoria right now who are suffering because how many people are not doing their freaking job?